Good morning, and thank you for joining us today. My name is Lisette Vienneau, and I am the president of the Canadian Society for Medical Lab Science, referenced to as the CSMLS. I'm joined by Christine Nielsen, CEO. Bonne journée et merci de vous être joint à nous aujourd'hui. Je m'appelle Lisette Vienneau et je suis la présidente de la Société canadienne de sciences de laboratoire médicales, communément appelée la SCSLM. La chef de la direction, Christine Nielsen, m'accompagne. The CSMLS is the national certifying body for medical laboratory technologists and medical laboratory assistants, and the National Professional Society for Canada's medical laboratory professionals. Medical laboratory professionals play a vital role in Canada's healthcare system, generating over 440 million results each year. With technical expertise, they provide the accurate, life-saving laboratory result that guides the diagnosis and treatment of patients. Our members practice in hospital laboratory, private labs, public health, government, research, and education. They are proud and passionate about their valuable contribution to patient care. We are in Ottawa today speaking with parliamentarians about the shortage of medical laboratory technologists. We are seeking support for important research that aims to increase the supply of new laboratory technologists through simulation-based education. About half of all medical laboratory technologists will be eligible to retire in the next 10 years. Shortages are already being felt in Canada's rural and remote communities. The current supply of new MLT graduates is not sufficient to offset the projected retirement numbers in virtually every province and territory. We project there will be a need for 400 additional new graduates per year over the next 10 years. Près de la moitié des technologistes de laboratoire médical seront admissibles à prendre leur retraite au cours des 10 prochaines années. On observe déjà des pénuries dans les communautés rurales et éloignées du Canada. La réserve actuelle de nouveaux diplômés en technologie de laboratoire médical n'est pas suffisante pour contrebalancer le nombre prévu de retraités dans chaque province et territoire. Nous estimons que 400 nouveaux diplômés supplémentaires seront nécessaires annuellement au cours de la prochaine décennie. As a member of the laboratory quality team supporting lab operation in rural areas of BC, I see the effect of shortages every day. Smaller centers, such as in Dawson Creek, British Columbia, really feel the impact of a single vacancy. The workload for other lab staff increases as everyone does their best to maintain the best possible patient care for their community. The strain sends the lab into survival mode. Staff are often unable to get enough rest after serving an on-call shift overnight. At another site, the lab was closed for 45 days because we did not have sufficient staff. During the closure, patients had to travel 100 kilometers to receive lab services. Situations like this are taking place across the country in our rural communities. With the demand for testing on the rise and the supply of laboratory professionals on the decline, Canada needs to increase the capacity of training programs nationally while maintaining the same level of graduate competency to protect patient safety. Safe and effective patient care is our top priority. We want to ensure that all Canadians, regardless of where they live across Canada, have access to high-quality health care. The federal government can play a lead role. I now invite Christine to discuss our proposed solution to this issue.
Thank you, Lisette. All medical laboratory technologist students must undertake a clinical placement like an internship as part of their educational program. Programs cannot increase spots without corresponding clinical placements, making this the bottleneck in the system. These spots are scarce due to current staffing shortages, crushing workloads, and lack of dedicated education personnel. In recent years, many laboratories have reduced the number of clinical placements offered or eliminated their clinical education programs completely due to workload burden and student supervision costs, both direct and indirect. To alleviate the burden on clinical sites, education programs can introduce or enhance their existing use of simulation-based curricula to effectively supplement or replace some on-site education. Simulation-based education aims to replicate clinical scenarios so that students can learn experientially in a safe environment for them and for the patients. If validated by research, simulation stands to help increase the number of new graduates and ensure that the increased throughput does not come at a cost to patient safety or to student success. Our proposed national medical laboratory simulation study seeks to develop and validate simulation-based curricula that will support student competency achievement, expedite students' entry into the workforce, and increase the graduate numbers. The study will determine whether simulation can be substituted for clinical hours. It will also construct evidence on the efficiency and effectiveness of varying amounts and types of simulation-based curricula. It will also determine the educational outcomes of students when enhanced and or new simulation is integrated into curricula, and to create a national database of simulation curricula available to all medical laboratory programs for adoption. The National Medical Laboratory Simulation Study is part of a long-term, multi-phase, multi-year research project. The CSMLS has invested over $150,000 to date to develop the foundation on which the study will continue to build. A formal grant application is underway with our key partners in education. We ask the government to support this important research and its aim of solving the shortage component for medical laboratory professionals on behalf of the health of all Canadians. The CSMLS looks forward to working with the federal government to ensure that patient safety remains the number one priority in Canada's healthcare system, and that there is an adequate supply of laboratory professionals to keep the healthcare system running at optimal levels. Thank you for your time. We would be happy to answer any questions you may have.
Questions? Thank you very much.
Thank you.